Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal Sentinel.
Mark Garthwaite of Madison is the Democratic candidate in the 77th Assembly District. The primary is August 14th. Mark, welcome back to WisconsinEye.
Thanks, I appreciate it.
I want to ask you about two things on your campaign website.
Sure.
Number one, why does Wisconsin need a public bank?
We do need a public bank.
What would it do?
There are many reasons why we would utilize a public bank, and it ties to one of the questions that I know we're going to talk about is the legalization of marijuana.
Go for it.
Okay, so if we embark on legalizing marijuana,
yes,
I think
which you support.
I don't oppose it, so let's put it that way, and
okay.
I'll explain why I say it that way.
Okay.
What I think is unrealized by many is that in the states that have legalized cannabis, the federal banking infrastructure is not available to make deposits. So technically, because marijuana is still classified as a Schedule I drug at the federal level, that means that any bank that is accepting deposits is technically breaking the law. So in the states where cannabis is legal, it's a cash economy. And I don't think many of us realize that. So we have Brinks trucks that are delivering cash to pay taxes. I don't think that's good. So North Dakota is the only state in the country that still has a state chartered bank. It was designed to provide low interest loans for projects that the traditional banking structure would not fund. That's an opportunity, I think, if we're going to embark on the path of legalization, that's an opportunity to create a state chartered bank that can do many other things. So infrastructure bank is a term that many would be familiar with. That's something that a state chartered bank could be utilized for to fund infrastructure projects that are badly needed and also return the interest back to the state. That's how the bank in North Dakota works, and I think that's a model that we should follow.
The other comment on your campaign Facebook page is a small but influential cadre of Republican elected officials have made some bad decisions. Talk to me about the worst decisions you feel they've made over the last 8 years.
The Foxconn is troubling to me. The Foxconn, handing $4.5 billion to an absentee owner who has no roots in Wisconsin. This gold rush mentality of that we're just going to strike it rich and shoot for the moon. In my day job for the last 4 years, I represent craft breweries, and they are the quintessential story of how we build businesses here in Wisconsin from scratch. They put down roots in communities, they take abandoned industrial buildings and reinvent them, and they become centers of economic development. So there's more of an organic growth that's easier to plan for. We don't end up having this giant development where we don't have a transportation plan in place for. Another example is Epic, right here in the Madison area. Epic was another example of the success story that grows organically, that spins off from the university. Those are the approaches that I think we should be taking to help our homegrown businesses grow right here. We have the talent here. I think we should invest in it.
So Epic is an example of how to do it right, Foxconn how to do it wrong?
I believe so. I mean, I hope that we can derive some benefit out of this project. I would not have voted for it, but we have it. Let's make the best of it. But my concern is that we are investing a lot of money in each of those jobs, and in the future, a lot of that will become automated. So think about the price tag for those positions. It's just going to increase. And I don't think that's good.
How do we pay for highways and bridges in the future? You're well aware of the impasse in the Capitol?
Yep, it's a priority, funding priority that has to happen, indexing the gas tax. That's another example of another poor decision, I think, and that crosses both parties, that not indexing gas tax has clearly been a problematic issue, so we should go back to that. I think an interesting approach for funding, not just for roads, but for schools as well, is that we have approximately 30 million tons of frac sand that leaves the state of Wisconsin every year. And the state is not getting anything back for that. So a $10 a ton tax on frac sand would bring $300 million into the state that would fund a lot of badly needed road repairs.
You want to go back to indexing.
Yeah.
Would you vote to raise the gas tax?
We're going to have to raise some revenue somehow, so gas tax increase should be on the table. There are other alternatives, so Minnesota is an example of a state that levies higher registration fees on luxury vehicles,
Depending
things like
on
that.
the age and the
Exactly.
cost of the vehicle. What about the discussion in the Capitol on tolling? You a fan?
I don't favor tolling. Again, that's the tolling infrastructure would have to be built. So I think focusing on just replacing the eroding asphalt is probably the priority. In the current climate, I'm not confident that tolling would be a public. It would be a public tolling. I think it would tend to be privatized, and I don't think that's a good idea.
In light of mass shootings, school shootings, do we need to change gun laws?
Of course, absolutely.
And those changes would be?
Well, so we've heard the talking points of the things that are unanimously popular around the state, the background the increasing background checks, limiting access to military assault weapons, the waiting periods. What concerns me is that we've been talking about these things for a very long time, and we run into the inertia. We get young high school students that march to the Capitol, which was inspiring to me, and then I feel that we're going to go back to doing the same things that we've been doing and just continue to talk about what we should do. The reality is we're not getting it done. So I think one way that we can take a new approach is there are 9 states in the country that allow for indirect initiated state statutes. Mm-hmm. Wisconsin is not one of them. So what that means is if the legislators are not going to get something done that has overwhelming support, citizens have the right to write a bill, send it to the legislature. The legislature can either pass that bill or reject it, or the governor can veto the bill. If it's rejected, it goes to referendum. So the voters have the ability to hold legislators accountable. I think that's the only way that we really have to hold legislators accountable.
So you support that constitutional change?
I would support that constitutional change. I am hesitant to get into the habit of legislating by referendum because in states like California, you go to the ballot and you see this long list of referendums that can make you your head spin a little bit if you're a voter. So the threshold to do that should be very high, but I think the overwhelming support for the simple common sense gun control measures that we're talking about could meet that threshold.
3 questions on healthcare. Number 1, healthcare in the rural areas where young people are leaving. You have an older demographic.
Right.
You have more and more healthcare being provided by Medicare and Medicaid.
Right.
How do we keep healthcare in the rural areas, maybe improve it?
I think we're going to have to get a little bit more creative. So there are, actually right now as we speak, a good example is that around in the Madison schools, there's a mobile dental clinic that's roving around the schools. So the kids that are in summer school, and not just in summer school, the kids that are in these neighborhoods around the schools have access to basic dental care. So we might have to, I know it's very difficult to recruit health professionals to rural areas. We may have to get a little bit more innovative and embark on mobile health clinics to at least provide the basic care that's necessary, especially for prenatal care. There's plenty of evidence that mobile reproductive health clinics have far better outcomes for young women and children.
You talked about dental care. Yeah. Medically underserved residents are eligible to receive dental treatment through a program sponsored by state government and Delta Dental.
Yeah.
These clinics are struggling financially due to
are.
low Medicaid reimbursements.
Right.
Should these dental prevention programs be a priority in the next Medicaid budget?
No question about it, and I think it's important to understand. So I don't know why vision and dental often get separated out from the rest of health care. It's all tied together, obviously. So poor dental health has lifelong consequences. So there's clear evidence that if you don't receive good dental care, you're more likely to suffer from cardiac disease later in life. So that's a funding priority, and it makes sense to make that investment up front, so we're not paying more catastrophic medical expenses later on in life. So definitely expand Medicaid, make Badger Care a public option. Those are important priorities.
So state government has a role in recruiting and retaining doctors, nurses, and other
it does, especially
medical professionals?
This is something we all need. It just stands to reason that we should be recruiting health professionals that can provide the very basic needs that our citizens need. And that's not just in rural areas. There are a lot of underserved communities that even mobile health clinics in urban areas would be very valuable.
Levy limits on local governments, time to get rid of them, dial them back?
They have to be dialed back. At a minimum. The needs of local communities are vastly different. That's in the experiences of traveling around the state over the last 4 years. It's pretty clear that there are very different needs in communities all around the state, and particularly in communities that do not see a lot of development. There's no new tax base to raise revenue to pay for the things that they really need. So levy limits we need to let the local officials have more of a stake in decisions on how tax dollars are spent.
In the current state budget, there's a rather large increase, in aid to K-12 districts.
Yeah.
Is it enough, or do we need another similar major bump in the next budget?
Well, I think we've dug a hole and partially filled it in, and then we want credit for doing the right thing. We're still behind, so that again, that's a funding priority. Devoting more resources, especially the University of Wisconsin is in the 77th district, and that's front of mind. Here, we have a legislature that tends to dictate to the university rather than having the university follow that Wisconsin idea of providing guidance to the legislature. It's kind of flipped on its head a little bit, and we need to turn that around.
Well, you mentioned the UW-Madison.
Yeah.
A big issue is their budget, and we've had 6 years of a freeze on resident undergrad tuition.
Right.
Should that freeze continue to a seventh and eighth year?
I think, well, I don't oppose having a freeze to make sure that tuition expenses are reasonable, but what's really happening is you have to make up that lost revenue in other ways. So segregated fees are now increasing. So we pay one way or the other, and the way I think we need to be approaching it is make it a priority to increase the state's stake in funding the university, because that funding level has decreased dramatically over a period of years. So the tuition freeze itself, it's not going to solve the underlying issue of underfunding our universities.
A big issue in the next budget, do we need a new state prison?
No.
Why?
I think we need diversion programs, focus on diversions. We already talked about the marijuana issue. I mean, there are far too many people who are incarcerated for offenses that are now legal in other states, and that really doesn't make any sense. We are quick to incarcerate. We send people back to prison for minor offenses that, frankly, we should be devoting more of those resources to helping them find good affordable housing, good paying jobs, give them some stability in the community rather than locking them up.
Part of the debate over K-12 funding is the choice program, the voucher program.
Yeah.
Started in Milwaukee, went to Racine, now statewide.
Right.
Your position on it?
It's time to wind it down. I feel strongly
Dial
that
it back?
It's time to wind it down and end it. I feel strongly that public dollars spent on schools should be accountable to the public. So if we have a different set of standards for privatized education than we do for public education, I'm a strong proponent of fully funding public education to give them the resources to meet everyone's needs.
Then final question, open seat four-way primary on August 14th. Why are you the most qualified of the four?
Well, we have the 6th largest research institution in the United States in the 77th district. So my background is in biomedical research. So I worked at the university for 17 years in the Department of OBGYN. I bring a voice of science. So we haven't had that in the assembly. We have 99 assembly representatives, and there are no science professionals that are in the assembly. So that means we have a science and technology committee that does not have any science, people who have a background in science inquiry. I think that's a problem. The DNR has had science professionals basically disbanded. So I don't think we've had that voice of advocacy for making sure that we are making evidence-based decisions, and that's hugely important in the DNR for environmental policy. And then finally, some of the uncomfortable conversations that need to be had is that Dane County is a very blue, it's a blue sea. We have elected officials at the municipal and Dane County level that do fantastic work. I'm grateful for the work that they do. The policy priorities I agree with vociferously. The Dane County Board is an example that has 37 supervisors and there's only one conservative on that board. So often it's a little bit of an echo chamber with people who are like-minded. And the state capitol is the complete opposite of that right now. So the past 4 years I've been working with legislators on both sides of the aisle on very complicated regulatory issues. The experience working with, in diplomatic ways, across the aisle is very different in the state capitol than it is when we're within blue walls of Dane County.
Mark Garthwaite of Madison is a Democratic candidate in the 77th Assembly District. The primary is August 14th. Mark, thanks for talking to WisconsinEye.
My pleasure.
Thank you.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, and Campaign 2018 partner Milwaukee Journal-Sentinel.